we're not here to talk about basketball. Let's
Right.
let's talk about digital health. First of all, for everyone in the audience, tell us a little bit about yourself and a little bit about Fenway and what the Fenway does.
Absolutely. And hi, everyone. My name is Nandini Choudhury. My pronouns are she, hers. I am the Women's Health Program Coordinator at Fenway Health, and my training and background is actually in public health and social work. And so to give you a little bit of information about Fenway, Fenway Health was founded about 50 years ago, actually, to serve the LGBTQIA plus community. And we are a free clinic. We provide healthcare for people without insurance. And we actually made the first diagnosis of AIDS in New England in the early 80s. And then Fenway Health then moved quickly into the forefront of AIDS treatment and research. And now fast forward to the present day, we are Boston-based. We are a federally qualified health center. And we provide an array of primary care services to over approximately about 3,400 patients. And via telehealth, now due to the COVID-19 pandemic, we've been able to reach patients in an additional 38 states where there are not robust networks of care for LGBTQIA plus folks, especially for folks who are transgender or gender diverse. We also do have a research branch called the Fenway Institute, otherwise known as TFI, that conducts behavioral, biomedical, and database research globally around many topics, including, but not limited to, HIV, sexual transmitted infections, risk reduction approaches, and overall population health projects. And I think in this way, we're really contributing to new knowledge in the field to advance best practices in medicine and in behavioral health for the global LGBTQIA plus community.
That's incredible. And again, I would recommend, just really, I think from the audience standpoint, please do reach out and connect with Nandini on LinkedIn.
Yep.
And just, before the program, Nandini, I was looking at all of the different communities that Fenway supports online and just the social community. You guys are extremely active in engaging the community, which is a huge part of healthcare delivery that very few people really do understand. So congratulations on all the good work there. But I think, if you could give us a little bit more detail about how you actually are using some of the digital platforms that you've developed to help make outreach and help engage your communities in the Boston metro area.
Yeah, that's a great question. So I'll start with our social media platforms as a form of doing really good direct outreach and sort of building a profile of being able to get people into our clinic, especially for the COVID-19 vaccinations. So, we've been using Instagram, Facebook, LinkedIn, Eventbrite to really get the word out within the social media platform. And then other digital platforms that we're using, we use Zoom for our telehealth appointments and meetings. We use our very own internal platform called Uber Conference for internal meetings as well. We use Microsoft Teams, and we also, I use this in a conference that I co-founded, which I can talk about later, Special Chat, which I don't know if folks are familiar with. It's a great platform to do networking through technology and through the laptop and computers. So it's this platform where you can build virtual tables and invite people to join those tables to really do networking virtually. It's fantastic, and I highly recommend it for virtual conferences, internal work get-togethers, etc. So that has been a great way to build networks while we have to stay, at home, work from home, or just be conscious of health and safety.
No, that's absolutely critical, right? And I think, we were just listening to Joe Mather. I don't know if you caught him from Pfizer, but he's the head of advanced science at Pfizer. And he's, he was talking about decentralized clinical trials. And one of the studies I did about almost 12 years ago now was around one of the first electronic health records for HIV patients put together with a study and some funding in like 2011, 2012. And it is unbelievable how incredibly important it is for engagement and studying some of the docs that were using this HIV EHR around the world. It was a global EHR and still is. And that's something that it takes a lot of engagement to do that. Maybe you can tell us a little bit more about some of the limits of these platforms and what you've seen as some of the barriers to their deployment and their adoption. And then also, how have you mitigated some of that and what have you done to turn that into a strength?
Right. I will say that once the pandemic hit, I was very impressed with how my own department, the Women's Health Department, and our Reproductive Health Department, quickly moved to doing telehealth and really just transitioning from in-house appointments to telehealth appointments. We actually moved pretty quickly to do that. And I'll actually start with the strengths of that, Stan. So, with the expansion of telehealth services, we were able to, reach folks who live 40 minutes, 2 hours away, 3 hours away outside of the state of Massachusetts for their reproductive health services. The limits, of course, with that is that, especially for OB-GYN care, it did limit in-house doctor appointments, to take care of folks who are birthing and getting ready to birth. So we had to really hone in on the policies of who could be in the birthing room, who was allowed to be in the birthing room. And, I think that was a very severe limitation that we just had to work with. Some other limits with being on the digital platforms right now to deliver healthcare is that Zoom fatigue is a very real thing for providers, for community organizers like myself, and for our community to constantly jump on to Zoom meetings back to back. And there's also, the barriers to access to technology for online services. And I think as we continue to use online services after the pandemic is over, we're going to have to think about insurance coverage for telehealth services moving forward. Some ways that we've been able to mitigate these limitations is that Fenway has been building a resource to deliver technology to folks who don't have computers, smartphones, so that folks can be engaged with us while we continue to work from home and work through telehealth. So that's been a great program to work with. And then another way that I've been able to mitigate these limitations is doing community partnerships with other healthcare organizations or organizations who, focus on medical care, so that we combine forces and we're able to combine resources to offer assistance to folks.
Brilliant. And tell us a little bit about some of the work that you do with your annual cancer awareness brunch.
Yes. So we every year, the Women's Health team organizes the Audre Lorde Cancer Awareness Brunch. And the brunch celebrates the life and work of Audre Lorde, who was this phenomenal, self-described Black lesbian poet and writer and feminist. And she paved the way for the medical community to be really aware of the health inequities that LGBTQIA+ and Black, Indigenous, people of color communities face when it comes to cancer care and cancer awareness. And so this year, we're hosting the brunch virtually on Saturday, October 16th, 11:30 a.m. to 1 p.m. So save the date, and we're in the planning process, and we'll be sending out invitations later in June through Eventbrite. And I'll make sure to send the Eventbrite link to the HITLAB team so they can distribute to the folks listening and through LinkedIn.
Yeah, I'm very excited to see that happen. And tell us a little bit about the future of where this is all going. So when you look at some of the technologies that you're deploying within your communities, which are the ones today are seeing the highest uptake, and which are the ones do you think tomorrow will be the most utilized on the digital technology side?
That's a good question. I honestly think that Zoom has been the favorite. for everyone in my field, when it comes to community organizing and conducting conferences, to use Zoom as the main platform. Right now it's very easy to do a webinar style where, you're just presenting, right? And then our participants can type in questions, or, you can open it up and you can see everyone, right? To make it more of like a community oriented based platform. And I think when we look at the future, we still might continue to use this platform as a way to further include people outside of Massachusetts, and even within Massachusetts, where, like I said, where folks have to travel almost 3 hours to get to us. So I see us continuing to use a platform like Zoom to continue to do broader outreach and engagement. I don't think we're going to stop using it.
I hope not. No, I
Yeah.
I don't think Zoom wants you to stop using
Exactly.
it.
Zoom has very much benefited from our business.
A lot, including this program right now.
Exactly.
And I mean, are you seeing any kind of pull through? And again, I've done a number of HIV studies and a number of studies in that area. But have you seen text messaging platforms or specific apps, or are they any kind of wearables? Again. Anything like remote blood pressure monitoring, wireless scales. We're seeing, in the general population, we're seeing more of those kinds of technologies. Are you seeing that as well?
Yes, so we're actually in the process of introducing that to our patients and clients, actually, as an easier way of handling primary care services, where folks don't have to travel however far away for maybe a 15 to 30 minute appointment, right? And then have to turn back around and take more time out of your day to commute and travel while you're working. I will say that from the women's health side of things, we're developing home kits to do in-home pap smears for cancer screening. We find not only is that a easier way for folks to do a pap smear, but it's also a safety measure for folks who may not feel comfortable or safe going into an appointment room to get a pap smear done by a provider they may not know or may not trust, because they have their own traumatic experience of, having medical care not go their way, or be, very racist or exclusive to how they identify within the women's health world. So we've been pushing that, in our policies and healthcare delivery models as an equitable way of delivering care, where folks can do the care themselves at home with proper training, and potentially using a Zoom or our Uber conference platform to do that in-home care.
Okay, that's really interesting. We got some questions from the gallery as well, and would love to hear your thoughts on these questions.
Sure.
But one of the things that I've taken a lot of time to study is sociotechnical analyses and of the populations of the groups, whether it's studies I do in India or Ghana or obviously Europe or wherever. The sociotechnical analysis is so critical. What are you seeing in terms of the sociotechnical preferences by language and things like this?
Yeah, so we offer all of our services online with interpreters, and also with folks who can do sign language as well, so that we can expand equity in that way. So for our appointments, if folks need interpretation services, we can have the interpreter join the conversation, so that there's clear communication. And then also with folks who may have eyesight or hearing disability, we also have folks who know sign language, or who know how to do dictation to expand that equitable way of delivering care. I know that the uptake was a bit slow at first when we were trying to figure this out, but I think when when we had a lot of our community partners sort of poke Fenway to say, hey, it might be a good idea to do this. So you should do it as we move forward with telehealth and Zoom conferences. And I think with that poke, we got better at Fenway to utilize that and to make sure that we do include that as part of our service delivery models. And I think that the studies that do that, socioanalytical studies, I think that's really important to make sure that piece is uplifted, right? When you think about doing these online platforms, to really think about what the community needs and what you should do when you talk about delivering equitable care through the digital platform.
Okay, brilliant. Well, again, Nandini, thank you so much for joining here today.
Thank you, Stan.
Really appreciate all the good work you're doing. Great job. Just